Before we can tube feed our kitten, to make it easier on yourself, you want to have everything ready. So to get ready, you're going to need your kitten. You're going to need a Sharpie marker or a piece of tape so that you can mark the feeding tube. You're going to need something to keep your kitten warm, like a Snuggle Safe warming disc or a heating pad, a towel to wrap up your kitten so that they don't grab onto your feeding tube and pull it out once you've put it in, nail trimmers in case you haven't trimmed your kitten's nails recently. The feeding tube, we like to use a 3.5 or a 5 French feeding tube, some lubricant, and syringe. You're going to want to calculate the amount of formula that you need for your kitten, plus you're going to add about 0.2 mils so that you've got a little bit of extra, and then you're ready to go. Now we're going to get everything in position so that we can tube feed our kitten. So we're going to put our heating pad down or a Snuggle Safe, cover it with a towel. I am right-handed, so I'm going to place the kitten's head towards my right hand. And if we haven't trimmed the kitten's nails recently, I'm going to do that now just so they don't grab onto my hand or to the towel or worse, the feeding tube, and pull it out once you've put it in. If the kitten's lively, you may want to wrap them in a towel just to avoid pulling the tube out inadvertently. Now we're going to measure the tube. So we're going to take our feeding tube and we're going to palpate the last rib in our kitten. We're going to put the tip of the feeding tube at the last rib and measure to the tip of the mouth. Then we're going to use a Sharpie or a piece of tape to mark the correct distance. Then we're going to load up our syringe with a calculated amount of formula, and we're going to fill the feeding tube so that it's not full of air. We're going to fill a little bit of extra formula so that we've got some for a test injection. And of course, there's a little bit of formula that is taken up by the feeding tube. Then we're going to cover it in some lubricant. I'm going to put the kitten in the towel, and we're going to get in a position. I'm going to hold the kitten's head in my left hand, and I'm going to take the tip of the feeding tube in my right hand. I'm going to feed it in the left side of the mouth and try and advance it into the esophagus, not the trachea. If we get into the trachea, the kitten may cough or sputter. And we're going to advance it gently all the way down to our mark. Okay. Once we're comfortable in the right place, we're going to pull back. If we get negative pressure, that's a sign that we're probably in the esophagus. We're going to give just a test injection to make sure. And we're going to put about 0.1 or 0.2 mils through the tube. If the kitten coughs or sputters or has a change in voice, we're going to pull out immediately. If everything's good, we're going to inject the rest of the calculated volume through the tube. Once the injection's complete, we're going to bend our tube in half just to avoid any spillage in the pharynx and pull the tube out. Then we're going to burp our baby. And that's tube feeding the kitten. We've calculated the amount of formula this kitten needs based on its weight plus a little bit of extra 0.1 or 0.2 mils. Then we've attached it to the red rubber feeding tube and primed it so that the tube is full of formula and not air. You can tube feed a kitten on your own, but gosh, it's so much better with an assistant. And sometimes for squirmy little guys, wrapping them in a towel can be helpful so that they don't pull out the tube once you get it in there. I put some lube on the tube and then I'm putting it in the left side of the kitten's mouth. So I've advanced the red rubber catheter into the left side of the kitten's mouth all the way down to the mark. I'm going to pull back on the syringe and look for resistance. If there's resistance, then I'm going to assume I'm in the correct spot. I'm going to give a test injection, look for the kitten to cough or have trouble breathing, which this kitten is not, and then I'm going to proceed with the rest of the injection of the calculated amount. We're going to give it pretty quickly, and As soon as we get to the end, we're going to crimp the catheter and pull it out and then burp our baby kitten.